systemic issue. It's also important for climate change, right? Global food and agriculture is a key driver of climate change, and some of the work we've done looking at health impacts of climate mitigation has found food to be one of the top 3 critical pathways if we are to get the health benefits from climate action. So what we're talking about here is a planetary health issue. Have I sufficiently painted the gravity of the issue, right? This is not simple issues. And the scale of the systems transformation we will need is immense. But let's say in no uncertain terms that the alternative path of not doing anything is untenable. Because what we have is incredibly hidden costs, both to health and to the planet. Over and above actually what we're spending. So on one hand, the cost of inaction is high. On the other hand, on the bright side, the opportunities to intervene, to actually change significantly our food system so that it works for us and for the planet are enormous, if only we can grasp that. Okay, so today we'll be talking about different aspects of the food system, particularly focused on availability, on access, and an adoption of nutritional foods. Because often when we're talking about food, we're often talking about individual behavior, but we really need to tackle some of the systemic and more structural issues if we are to really take a more systems transformation approach. So on that note, we are honored to have His Excellency Ferdinand Marcos, the President of the Philippines, join us, and just to open up the session to share your perspective on nutrition security in your context and why it is such a priority issue for the Philippines. Over to you, Your Excellency.
Thank you very much for your introduction. I'm pleased to be joining you this morning. And as we acknowledge the distinguished panel experts, academics, executives, and officials who we will be hearing from during the discussion period. It is quite apropos that we hold this gathering prior to taking our midday meal for the day. For us in the Philippines, an essential and perennial component of a meal is one served with rice. Filipinos join over half the global population where rice is an essential grain, the veritable stuff of life. We simply cannot get enough rice. It was not too long ago, just over 70 years, when the Philippines embarked on an experiment to fortify rice with thiamine and other nutrients, where this experiment helped solve the severe problem that was existing in our country then of beriberi, which was a leading cause of death at the time. It's now considered as a model for public health nutrition and for rice enrichment programs in other countries. Beyond rice, we created the National Nutrition Council 48 years ago to supervise, coordinate, and evaluate the National Nutrition Program for all public and private agencies. Food security remains at the forefront of our national agenda, anchored on our vision for a prosperous, resilient, and secure Philippines by the year 2040. The overreaching goals of this administration that are to build an inclusive society when no one is hungry, where Filipinos live long and healthy lives, and where they are provided with an environment built upon trust and security, and where they can be innovative and remain smart and responsive to the problems of the day. Underscoring all these lofty goals is ensuring that each and everyone is provided with quality and ample nutrition. In a 2021 Global Food Security Index, the Philippines ranked a modest to mine from us here to the people back home. Among our priority interventions are those geared towards making food available, affordable, accessible amid the looming global food and energy shortage. Government spending will focus on productivity-enhancing interventions for the agricultural sector, research and development, is going to be a very important component for this, as with the advent, as has been mentioned, with the advent of the climate change issues. The impact on climate change has to be part of that discussion. Government spending will focus on on the agricultural sector, but also it will in the distribution sector. For as all governments, we buy a lot of food to provide for our schools. There's a feeding program for children to provide for, especially during the pandemic, for assistance to those who are in trouble. And we have learned during our sessions here that systems-based and data-driven cooperation is key to achieving security, and the challenge we face in nutrition is no exception. So let me offer a few ideas. We must, first of all, boost productivity in agriculture and fisheries, including through climate-resilient technologies, and promote production even in non-agricultural areas, such as urban and vertical farming, and community gardening for subsistence supply. The food from the toil of our own hands is the food that will most nourish our bodies. We must invest in facilities, logistics, and systems that bring the nutritious food to our people, much like a grander scale of farm to table, and increase the capacity of our institutions to enforce regulations that enhance food quality. We must also cooperate to develop technologies that increase the nutritional value of our food and content and prolong their shelf life, which are sometimes contrary goals. And again, we count on the research and development that will be undertaken and the new technologies that will be discovered for us to be able to bridge that gap. Let us incentivize a nutritious lifestyle, promote active and health-seeking behaviors across different ages and income levels, and create an ecosystem based on the concept of green and circular economy. We are looking to working with the WEF and various stakeholders on a holistic and integrated plan covering both food security and nutrition security. The work of the WEF's New Frontiers of Nutrition, a vital component of the equally vital Future of Consumption platform, is commendable in this regard in providing us all with the first big leap towards nutrition security through a common paradigm on the purpose of nutrition and the future of food, and developing principles and indicators to sustain our efforts while aiming to create economic value for nutrition. Friends and partners, I look forward to productive and insightful outcomes from this discussion today. I'm confident we will be able to arouse high impact, actionable, and collective ideas to steer us all forward on our common goal of nutrition security, not only in health and food, but especially in the quality of that food. I wish you all a nutritious lunch, but not to be had before an enjoyable and productive panel session. Thank you and good night.
Thank you, Your Excellency, for just highlighting. I like the one word you said, which was action, action-oriented. So just heads up, panelists, we're going to be focused on pinning you down on some action-oriented approaches going forwards. Thank you very much. If I can just thank the President. And as we are just switching up, before we move to a panel, I'd like to acknowledge the forum's Future of Consumption platform and the New Frontiers of Nutrition initiative, which the President mentioned earlier, for their role in bringing these partners together to look at how we can improve nutrition security. So without further ado, I would like to invite, in this order, Darius Mozaffarian, who is the Dean and Friedman School of Nutrition, Science and Policy at Tufts University. Darius is a cardiologist, policy scientist, and founder of the Tufts Food and Nutrition Innovation Institute. I'd like to welcome Geraldine Matchett, who is the Co-Chief Executive Officer and Chief Financial Officer of Royal DSM. Welcome. I'd like to welcome Sir Mohammed Jafar, Chairman and Chief Executive Officer of the Kuwaiti Danish Dairy. And last but not least, Sam Kass, who is a food entrepreneur, former senior White House policy advisor for nutrition, and executive director for the Let's Move Lady Michelle Obama's campaign of the First Lady. Thank you all very much. Please join me in welcoming them. Okay, Darius, I'm going to start with you to just paint us a little bit of a picture. So as an academic, you're a cardiologist, so you see, you're an academic and you on policy side, so you try and prevent, but you're a cardiologist, so you see what happens when we don't succeed in preventing. Can you paint us a little bit of a picture to really set the tone on why this conversation is so critical?
Yeah, well, thank you for outlining such an important a baseline, and also the President's comments really, I think, level set us. I want to make 3 key points about nutrition to start. First is that I really think this is one of the single biggest issues facing the planet, and we're not giving it that attention. As an example, the estimate is about 11 million deaths per year directly caused by poor nutrition. Most of that is due to chronic diseases. That far exceeds the annual COVID deaths that we've had. We've had in the first 2 years about 3.5 million COVID deaths a year, and if you add missed deaths, excess deaths due to other causes, it's about another 4 million deaths. And so think about how we upended the whole world to address COVID, and yet we have more deaths every year from poor nutrition, and we're really mostly ignoring it. And I think that's really a major issue. Second, related to that is not just the cost in human life, but in human suffering, lost productivity, and the economic costs. The economic costs of preventable healthcare spending. As has been mentioned, those externalities cost more than we actually pay for food. And it's also driving terrible health inequities. So across nations, within nations, this is not the top issue for health equity, but it's one of the top issues for health equity. And this is a global problem, so we shouldn't think of this as a high-income country problem. I think of diabetes as kind of the bellwether for the nutritional health of a population, even more so than obesity. In the US, about 11% of adults have diabetes. We think that's high. It's actually not very high compared to the rest of the world. In Tanzania and India, it's 10%, so both very similar to US. In China and Indonesia, it's 11%, exactly like the US. In Guatemala, it's 13%. In Mexico, 17%. In Saudi Arabia, 19%. In Malaysia, 19%. So this is a global problem in every country in the world. That's the first point, is this is a big problem. The second point I'd like to make quickly is that the reason we have this problem is we have a 20th century food system that was built for the 20th century problems, but now we have a 21st century issues facing us. The food system we've built today was a very intentional, conscious development from really 1950 to now, over the last 70 years, to address the 2 biggest challenges of the 20th century, which were vitamin deficiencies, as was mentioned by President Marcos, was a big killer around the world, and lack of calories, as we had a population explosion. We should really stop and applaud that we address those problems. The food system was created, the monocropping, the agricultural production, the processing of food, the fortification, dramatically reduced hunger and starvation, dramatically reduced undernutrition. And so now we have, because of those changes, the epidemic of diet-related chronic diseases. And so my second point is that we can reverse engineer or re-engineer the food system in much the same way with new goals and fix it in 20, 30 years. This is not an insurmountable problem. We did it before. We can do it again, but we have to really recognize the political will. And so that's really my final third point, is that this is fixable. That's what's most exciting to me. There's a lot of big problems in the world: war, racial prejudice, climate change, many other things. This is one of the problems, like climate change, we can actually address and fix and do a lot in just 20 or 30 years. And so hopefully we'll be able to talk about solutions more as we move on with the panel.
Thank you. That's really excellent painting picture. I like that you bookended. This is a monumental issue with it is also a solvable issue. So I think that's something to bear in mind. Geraldine, I'd like to come to you next. So having painted that picture, the food systems, particularly from a perspective of availability, with Royal DSM, obviously you're a key actor in that space. How do you see how your role in shaping food systems and particularly from a nutrition security perspective?
Exactly. Firstly, I would like to say that it's such good news that we are now finally talking about health and nutrition. There's been a long journey from focus on hunger to malnutrition, to hidden hunger, and now we are kind of taking it the full way, which is how do we have effectively a healthy planet and healthy people. Now, as Royal DSM, we're very involved in food systems, and it's impossible to talk about food and even nutritional security without talking about food security and climate. And so maybe a few additional facts to set the picture. Let's not forget that food represents about 12% of GDP, but it represents a third of greenhouse gas emissions, 40% of jobs, 70% of fresh water use, and 80% of deforestation. If there is one thing which is fundamentally connected to climate, is food production. It's the oldest human activity on Earth. It will continue to be because we need it every day. And to a great extent, we did a great job in feeding a growing population. I mean, in the lifetime of my mother, the world population tripled, and we forget about that. We went from 2.5 billion to 8 billion. And that needs to be sustained by the planet. And the food systems that we developed was really focused on, indeed, volume, quantity, that type of thing. Now, to some extent, therefore, food production and nutrition linked to it has been a great driver of some of the aspects of climate. Now, take the year 2022. It has been the year where everything has, I think, jumped to everybody's attention. One is food security cannot be taken for granted. We knew that there was a growing crisis coming because of climate change, but you add climate, COVID, and conflict, and of course all the problems with trade. Now, two predominant, I mean, across so many countries, if not all countries, the cost of food has gone up and availability has gone up. And one of the big fears, and maybe I hope we'll have a good discussion about this, is that the fear of availability and affordability will then maybe take back some of the issues around the health and the sustainable aspect of food systems. So a lot of things to go there in terms of a little bit the perfect crisis and the broken food systems. Now, there is good news in this, and that is that what we're seeing is that the whole space of the food systems is being looked at in an integral way, as opposed to piece by piece. So going from regenerative agriculture, which has a climate and a nutrition aspect. We effectively eat what comes from the soil. So if the soil is depleted, if the microbiome in the soil is not there, you don't get the right micronutrients, etc. So let's start where it starts, which is from the soil, all the way to the food production, food trade, food composition, and consumers. Let's not forget the consumers. Consumer knowledge, consumer awareness, consumer insights, transparency. So there's so many things to talk about, but fundamentally, healthy people, healthy planet go together.
Yeah. So I'm going to come back to you, Geraldine, particularly thinking about the key actors that need to come together, because part of the issue is that we work in silos often, right?
Exactly.
But we'll come back to that. So coming from the availability and access, we're going to move more to thinking about industry. So Mohammed, your company, Kuwaiti Danish Dairy, you've been on the journey to re-engineer, right? So a key part of access to healthy foods is looking at what is available and how can we actually re-engineer to access more healthy food. Can you tell us a little bit about what you've learned on this journey and what do we need to scale it? Because we need more than just you working on this. It's a big problem, as Darius mentioned.
Thank you. As Darius said, you know, it's a big problem, and there was a time when we didn't have this problem. So I'm sure we will be able to fix it. It may take time, but it is fixable, and that's the good news. When was the time when we didn't have this pandemic of metabolic health that is crippling our national health? That was before the 70s, I suppose. That was a time when people cooked their meals at home, when there wasn't shelf-stable product that's microwavable. People ate 3 times a day, so they were not spiking their insulin level all the time. And yes, the achievements are not to be underestimated. We have fed the planet. We've given people food. We've kept them from dying or from hunger, from starvation. But now the pendulum has swung to the other side. Now more people are dying from obesity, from metabolic syndrome diseases, than are dying from being malnourished or from hunger. So is the system fit for purpose? No. How broken is the system? We know the numbers, but I'd like to remind the audience what the numbers are. Last year in Davos, when we tried to calculate the value of the food system, I think it was a United Nations report that came up with the numbers, that the system is valued at 9 trillion. So that's the value of the entire food system worldwide. But the damage it was 20 trillion, of which 11 trillion are health related and 7 trillion are related to nature. So as a food manufacturer sitting upstream, I'm creating, me and the rest of us are creating a problem that's so huge we would go broke if we tried to fix it. We couldn't. It's bigger than us. So how do you fix that? When this news came to me, I went home and I said, what is it that we are making? If I'm a problem, I want to solve the problem. If I listened to advice in the 70s that said, push carbohydrates, and I pushed carbohydrates, and now it seems that sugar kills, then what do I do about the products that have sugar? So I took all of the products that we have, and this is something that is scalable, and others who want to participate in what we're doing, we're very happy to share this with them, freely, competitors or others. We took all of our products, everything we make, and all of the ingredients that went into them, and we sent them. We created a scientific team in America that's independent. We said to them, what's healthy? And they said, well, if the food, and this is our metabolic matrix, this is our definition of what healthy, what nutritious should be. If it doesn't harm your liver, if it feeds your microbiome, if it feeds the gut, and if it feeds the brain, then make this food. If it doesn't, don't. So we sent all of our products and the ingredients to a lab in America to have them chemically tested, to see how these products would scale up. And some of them did very, very badly, like orange juice. You'd think orange juice is good for you, but it turns out it has fructose in it. Fructose attacks the liver in the same way as alcohol does, and can give you fatty liver disease. So we asked ourselves, why are we making juice? Why is the world making juice? This is a question that we need to address. We cannot hide away from it, us or the industry. And this is an area where we need to scale down rather than scale up. And then we had products that, some products, you can neutralize this, for example, juice. You cannot make it good. That's the finding that the scientific panel came up with, but you could add fiber to it to neutralize it. So do you want to sell a food that doesn't actually serve a purpose? Others had more hope in them. So products that had sugar, like a chocolate milk, we replaced the sugar with another type of sugar, but this one, which is also naturally occurring, doesn't cause your insulin level to spike and doesn't cause diabetes. It has the same number of calories, and this is where I want to differentiate, that the narrative should not be about calories, because you have two products here, a chocolate milk with a sugar that will make you addictive, that will make you come back, that will spike your insulin level, that will cause problems in the health system, and another product that doesn't. So as a consumer, I don't have the choice of the other product. And I've been given by the government, by the American Heart Association in the 1970s, nonetheless, by the American government, go carb, go carb. But if this product, the chocolate milk with the sugar, if this one, the recommended daily allowance of sugar is 0. Why? It's because that sugar doesn't actually feed any cell in the body. So I think we need to ask ourselves big questions. The good news, and I want to come to some good news, some landing maybe, is that A, we're talking about it. B, we live at a time when technology and the fourth industrial revolution, it's exponential, the changes that we are seeing. The impossible can become very possible. So there are some quick fixes. If we know that something causes inflammation, then we must take steps to replace it with something that doesn't. And I don't want to point the finger at, say, something like high fructose corn syrup, which is something that has been used in the diet to provide foods that are cheap and shelf stable. But at the end of the day, they appear cheap because you're paying $1 for it today, but actually you're paying $3 because it's $1 today plus the $2 that it's causing to health and environment going forward. Right. So I think we can reverse And I think this is something that is doable.
Okay. So I'm going to come back to, thank you for that. I'm going to come back to you in terms of scaling, and I'll ask you a very pointed question, a low-hanging fruit, so it's a wild card. So we've covered availability, we've covered access. Sam, adoption was the third A that I mentioned from the initiative that was mentioned. Obviously, we can have all the food available, but there does need to be some adoption. And you've worked in this space. Can you tell us a little bit about your experience and how we actually drive adoption of and consumption of healthier foods?
Sure. First of all, thank you for having me. It's great to be here. I really appreciate, as always, your comments. Before I get to adoption, I will just say, like, the biggest threat to nutrition security is climate change, like, by far. And so all of us who've been working this issue for a long time have to become simultaneous climate change warriors, because as bad as the situation is, as Darius laid out, it's about to get existentially worse if we don't make fundamental shifts in how we produce our food and the impact on the climate. So we have to continue to root all of this conversation. And luckily, it's not one-to-one correlation, but there's a lot of correlation between what's best for the planet and best for us. Lots of comments on all these things, but I'll stick to your question, which as an old DC guy, you don't normally do, but I'll stick to your question. Look, I think, on this question, honestly, I think I like to rob Coca-Cola's mantra, ironically. And my dear friends at Coke. They built their business on a very simple concept, which was within an arm's reach of desire. So it means two fundamental parts of the strategy. One is to make, for them it was Coca-Cola, for us it's nutrient-dense food, within an arm's reach. What does that mean? For us, it means make nutrient-dense options really affordable and, of course, delicious, right? And so a lot of the solutions that we're ultimately talking about have to be empowered by the supply chain, have to be empowered by producers. Innovation and technology is going to make the economics of all of that work, because right now it doesn't for a whole host of reasons. We've invested an statistically insignificant amount on nutrient-dense foods compared to the big commodities. It's not because of ag subsidies shape all that and distort it to any measurable level. It's because we've invested no money in figuring out how to bring nutrient-dense foods through. So I'll stay on the demand side, but the demand is really unlocked by very specific investments and innovations and different approaches on bringing those products to bear. But we have to surround people with much more nutrient-dense foods, and then we need to make them desire to want to eat them. That's marketing. So, right now in these conversations, we tend to, and all my medical friends and advocates and everybody likes to talk about, vitamin B and fiber and what it does to your gut and all these things. And yes, all of that is true. But love, sex, and happiness beats fiber, vitamin B, every single time. Yeah. It just kicks their butts. And so we have to do a much better job at speaking to people's hearts, which is how we make change, and behavior change is all rooted in emotional, not cerebral reactions from the brain. And make it what we value. And there's a lot of components into it, but nothing new here. There's no magic here. What do companies do? They get celebrities, they get soccer players and rock and roll stars, Beyonce, Jay-Z, Ronaldo. You get these people to start holding up bean dishes, and as opposed to sugary beverages. And so, but it's true. You get chefs who, as I'm a recovering chef. You get chefs to start putting these kind of foods on their menus. And the one thing I will say is we sit in all these conversations, and they're all very important. And I'm very relieved that we're finally talking about food, both on the health context and the climate side. Finally, although it's still way smaller than it should be. We get lost in the complexities at a very high level. And all these complexities that we talk about and all the levers we have to pull, they're all true, right? But it's also pretty fundamentally simple. It's like, how do we find some key new ingredients and along the value chain decide we're going to this year focus on this ingredient and we're going to get more of it out to the world. And we just took been pushing some folks on beans. Just start with beans. Start with anything you want. And say, okay, I'm a chef, I'm going to put 2 more bean menus on my menu. I'm a food company, I'm going to create a new product based on beans. Year over year, Instacart can say, here's the bean options when you buy. Year over year, if everybody just starts focusing on a couple key solutions, that adds up. And I think we got to get out of the clouds and start saying, okay, this is the first steps we're going to do. We're going to prove to ourselves that we can actually get something done. And demand will come. Make it sexy, and people are going to eat it as long as it's delicious.
Thank you so much, Sam, for really highlighting. This is one of my bugbears around. When it comes to healthy food, we say, oh, people have individual choice, and but when it comes to unhealthy food, we market the hell out of it. It's like, there's no kind of, let's just leave it to them, they're not. So there is this kind of dissonance, right? We think you should just know better, and we don't put as much of the behavioral science, as much of the psychology, as much as the marketing, all the expertise that we have in those spaces to get people that have got people to consume more unhealthy foods. We haven't harnessed that into the healthy food space yet. So thank you for highlighting that. Darish, I'm going to circle back to you. I'm going to come back to you, Sam, in terms of partnerships, because you're talking about scaling up particular ingredients, and that's a kind of a trans-border effort. So come back to you on that. But Darish, I want to talk about policy, policy coherence, both locally and globally. So there's sometimes a dissonance and disconnect between policy for healthy food might conflict with the policy for trade. And that's the reality, right? So given your work in kind of policy, what do you think we need to do to be more coherent in that space? And globally, and this is really critical as well, sometimes you have countries that have we're going to get rid of sugar and do this in our country, but what they're doing globally, in terms of their global policy, is making the problem worse and is making it difficult for other countries to regulate because of trade agreements. So very difficult question, but I think it's something that we have to confront, because there is a loss of food sovereignty in a lot of countries where actually your trade agreements have tied you into things that you cannot then do.
Yes.
So let's talk about that.
Great question.
In about 2 minutes.
Sure. I'll take 3. So I think that policy change is absolutely fundamental. And when I say policy, I don't just mean government policy. I mean corporate policy. There has to be systems change. And I'll maybe don't count this against my time. I'll use this example from something Sam Cass achieved, which was the Healthy Hunger Free Kids Act in 2010, which dramatically improved the nutritional standards for school meals. So we published a paper a couple of years ago looking at trends in diet quality across the United States over 20 years based on where the food was purchased. And so we looked at restaurants. About 80% of the food 20 years ago was of poor nutritional quality. About 80% of it today is about poor nutritional quality. With everything we've done, all the discussions about improving food and everything, it's 80% poor nutritional quality, no improvement. We looked at grocery stores. It was about 50% poor nutritional quality in 2000. It's come down to about 45% poor nutritional quality. That's a big change on a population level. That's a terrific, positive thing. Everything we've done, all the work we've done has led to that 50% to 45%. Schools, with this one single policy change to improve the nutritional standards, about 55 to 60% of school meals in 2000 were of poor nutritional quality. Today, it's about 20% of school meals are poor nutritional. They've come dramatic improvement. And everything else I mentioned about poor nutritional quality, there's huge inequities with people who are lower education, lower income, of racial ethnic minorities, have even worse diets, and people who, in schools, there's no inequities. Everybody's nutrition improved together. So if we do everything possible without policy and systems change, we'll get these little incremental things. And that's kind of what we've been doing for the last 30, 40 years with the global obesity epidemic that's growing. We need to have policy and systems change. And so I think that the way to have coherence first is to follow the dollars. If we show that there's immediate, not 10 years from now, 20 years from now, 1 year, 2 year economic benefit to these actions, that's the coherence, right? There's no convincing if we show that we're going to reduce diabetes. Diabetes costs usually the #1 healthcare cost in almost every nation. We're going to increase productivity. We're going to increase jobs and businesses. This has been the mantra for green energy, right? Companies now are countries now are focusing on green energy because it's economically important for them to have the companies and the jobs of the future, right? Not because of they really care about climate change, because they really want to have the economy. So I think you have to follow the dollars and show the line between fixing nutrition and health. And then I think in the realm of policy, just to close, I think there's 4 big levers that we need to invest in. So I think one is healthcare. As a cardiologist, it drives me crazy that the #1 cause of poor health is ignored by the healthcare system. Yeah. In high-income countries, in middle-income countries, and with the absence of vitamin supplementation in low-income countries. So we have to use the healthcare system in every nation to prescribe and pay for healthy food. That's #1. #2, we have to leverage procurement, government procurement, private procurement. Governments around the world buy a lot of food for schools, for prisons, for military, for their offices. We have to have procurement be a lever to increase demand that will then increase payment to the farmers, that will then increase payment to the companies that are making the food. #3, we have to advance and reward business innovation and entrepreneurship. Right now it's a Wild West. If you make a company and make a premium product and it's healthier, you hope the market will reward you, but it might not. And if you're a big multinational food company, you make a healthier product, you spend a lot of R&D, it doesn't sell, you get fired, right? So we have to have tax policy that rewards companies that are innovating and doing entrepreneurship. And then last, and I think WF can really do this, is we have to create an international consortium for research. There's so much we don't understand about obesity and diabetes and food. There's so much we don't understand. We understand a lot, but there's a lot we don't understand. And so governments have been spending a tiny fraction of their research dollars on obesity research related to food and nutrition. Why don't we get all of the major multinations together with the private sector pushing them to create an international consortium for food, nutrition, obesity, and metabolic health research? So
that was a formidable effort. That's a big question.
We can do it, yeah.
Thank you so much. And for picking up the measurement aspect of things and kind of evidence generation as we go. Geraldine, as promised, partnership. So picking up on that, on the coherence issue as well, one of the things that I've noted is sometimes there is good innovation, but it's not necessarily implemented at the same scale globally. So you can have the same company reformulating in Europe and still selling higher sugar content in Asia, right? That still happens. How do we ensure that from an industry perspective that we're achieving that global coherence? And what partnerships do you think, from your point of view, what would help you in your work to accelerate what you're championing?
Maybe 2 thoughts there, because global coherence, yes. But at the same time, all the work that's been done on the nexus between food production, health of people, and nutrition, we have come up systematically to the same conclusion. It is a local system that you need to look at. It's locally produced food, it's local challenges. So we have, of course, talked a lot about the too much, but there's still the too little in the world. So let's not forget. So President Marcos also mentioned things like fortification, which are essential, availability of proteins, etc. So the more we've looked at this nexus of food system transformation, planetary challenges, and health challenges, we come back to a unit of action of country. Country, because it's effectively country and crop kind of combinations in many aspects. And when it comes to collaboration and coordinating efforts, actually what is currently taking place here at the World Economic Forum is to look at the nexus of nature, food, and health. And in that sense, health through nutrition, really looking at a cross-sectorial approach, because when food fails, everything fails. Stability of the nation fails, but clearly the health system fails, etc. And then taking it more from, which is quite new, from the health picture of, if we look at, and that is pretty much true across all countries, the cost of healthcare is spiraling. Populations are aging or are growing very rapidly. 2 different challenges, but one way or another, governments around the world have the problem of how do I manage that? And going from a prevention as opposed to a fixing. And so in terms of addressing, rather than saying formulation needs to be the same everywhere, how do you actually assist in coming up with a a roadmap, a plan.
That you connect to the health
and you
data.
connect. So you connect the healthcare bills, take maybe the top 5 non-communicable disease issues linked to diets. From there, what are the concerted efforts that we should all have? It could be obesity, it could be diabetes, but in some other cases it may be simply still deficiency at scale. Unfortunately, in the world, 1 in 2 women in the world are macronutrient deficient, and that is a firm statistic. It is huge. So connecting from healthcare bills to what can we do, but in a cross-sectoral way, because often you have issues of transparency. I have to say, quality control. I mean, that's also a big labeling is another one. Regulation. So how can we, in concerted way, across different parts, whether it's the food industry, whether it's actually the healthcare practitioners, whether it's the ag part with regenerative ag, come up country by country with the must-win battles and not take, I'm fully with you, not take 20, take the top 3 and then work.
Fantastic. That kind of follows on very nicely. So Mohammed, low-hanging fruit. I was at COP27 in Egypt, and we were talking about health and climate, and food was part of what we were talking about. But at this meeting with tens of thousands of people, the food environment was very obesogenic. I'm being very frank here. Was anyone else there? Right. How could we get COP28? It's a very specific question for you, because I think your work is really innovative in what you've done with your company. What would we need to do to get the food environment in Dubai at COP28 to be healthy, so that irrespective of whether you're in a food session or in a health session, you would notice food and nutrition at that meeting? What could we do?
I think a small example of something that was done in England when it came to salt content. There was a meeting behind closed doors whereby the politicians sat with the industrialists and they reduced the level of salt in foods. I think a lot of the things that you can do, you don't have to have a referendum and ask consumers what you want. People will eat what's on the shelves. If it's on the shelf, they'll go and pick it up. They'll put it on the table, whether it's at COP28 or anywhere else. So it's about availability. So what is available?
So how can we get, who are the actors you think? I'm going to be very specific for COP28 because it's a very practical, we've run out of time.
Names and emails, please.
Yes. Who do you think? No, but seriously, because we've got 10 months.
Yeah. I spoke today with President Marcos. Earlier today, I spoke with the Minister of Industry of Saudi Arabia, trying to let people know what the issues are. I think we have to have an awareness matter first, so that what you see is what they see. If there's no alignment on the vision and understanding, then we're not going to be able to progress further. I don't have a magic wand for what we can do in COP28, but I think if you frame it properly, I think it's on us to frame it properly. If we frame it properly, then it will translate into that. And if you want to have an environment that is healthier, then it has to be sold as something sexy. And a lot of time we crave things that are not good for us. And if you tell them they're good, they don't want to eat them. Right. So you have to be aware of that.
So my takeaway from that is, Mohammed, on behalf of the New Frontiers Initiative and WEF, are going to be looking at the COP28 presidency and looking at how we can improve that. Finally, I'm just putting that on the record-ish. Sam, we've run out of time, but participation is, I think, really critical of getting people as part of this demand. How do we engage the public in being part of driving that demand and driving the accountability to say, you know what, this is my food environment and I demand a healthier food environment and this can't go on?
Just briefly, I mean, look, we talk about these massive problems, both on the climate and environment side and on the nutrition side. Food is literally, and agricultural systems are the only solution we have, fundamentally. It's the only solution we have to get enough carbon out of the air in the ground in a time horizon that we have, that the science tells us we have. It's the only scalable solution that I see. Like nothing close. You hear about all the other technologies, nothing's close. And on the diet side, all these problems that we outlined, the only solution is to eat more nutrient-dense foods. And so I think people are convinced on the health side. I mean, I think we've done I'd love to see some of your research on like the transformation over the last 20, 30 years on perceptions around health and connections of diet and their well-being, I think we made a ton of progress around that connection. Right now, we don't have access to the right kind of foods, and it's not the culture fully embodied to make it sort of the sexy way of life. So embedding those options, I don't think it's just a demand problem. I think the demand is there. We just have to make it really easy for people.
Yeah.
And right now, it's too hard. You're asking parents of, I got 2 kids. Even for me, I'm like Michelle Obama's nutrition guy. Like, this is my whole life. And even for me, I got 2 little kids, and I'm like, all right, should I do nuggets? Because I'm tired, you know? Like, so it's hard. And we got to make it much easier for people to get this on their plates. And that, if we just stay focused on that and embed it in our healthcare system and embed it in these policies that Darius talked about, I think you're going to see a virtuous cycle that starts to take on a lot more momentum than we have today.
Thank you so much for ending on that. I'm going to end with an anecdote because this is really important, because one thing we haven't mentioned is trust. In 2020, late 2020, early 2021, I was part of efforts to kind of community outreach to address vaccine hesitancy, COVID vaccine hesitancy, particularly in black and brown people in the UK, right? So we had this Insta Live session with this influencer barber. It's like, yeah, it just makes me so